First of all, we will start with aphasia. What do you mean by aphasia? Aphasia is nothing but partial or complete loss of speech or language which results from damage to speech centers which are located in the dominant hemisphere, right? So you should know what is speech in first place, right? What do you mean by speech? Speech is nothing but it is an articulation which is relative a higher function of the brain, and speech is basically to communicate, to express or understand your thoughts and ideas through the medium of symbol, or which may take the form of spoken or written words. So that is basically speech. Imagine how humans could survive without that speech or language, which is part of our day-to-day activity, right? So, to understand aphasia, you should know what is speech and what is language and their importance in human communication. So, aphasia basically is nothing but a partial complete loss of speech or language resulting from damage to speech centers which are there in dominant hemisphere. So, please remember this part, that left is more dominant. Left is more dominant in 95% of the people. The left side of the hemisphere is the dominant part, while right hemisphere is only dominant in 5% of the people, and it is also called as crossed aphasia. If someone has lesion in the right hemisphere and speech is hampered, then we have to suspect that he might be a right dominant person. So that is called as crossed aphasia. This is one term which must be known by everyone. So this is basically a question which is usually asked in your exams. What do you mean by motor aphasia? Lot of MCQs are being asked related to this aphasia. So please mark this as an important question which can be asked as a SAQ or a practical question. Okay. So motor aphasia is also known as expressive aphasia. Okay? These are the synonyms which must be known by each and everyone. Expressive aphasia is nothing but your motor aphasia. Difficulty in word finding as well as thought formation. And this is impairment of your verbal expression. Okay? It might look difficult in first first go, but once you start understanding, it is quite an easy topic to understand. So, important terminologies which must be known by each and every student related to aphasia or speech examination. You should know what do you mean by defect in hearing. Hearing, when it is defected, it is called as deafness, right? It is called as deafness. Defect in understanding is called as receptive aphasia or sensory aphasia. It is also called as Wernicke's aphasia. Okay, then defect in thought or word formation. As we have seen, thought and word formation is nothing but motor or expressive aphasia. Defect in voice production is dysphonia. Defect in voice production is dysphonia. Defect in articulation is dysarthria. So these are the basic terminologies which must be known by every student so that you can understand. Okay? There are other few things which must be known by everyone, right? Disorder of language, okay, is aphasia. Please remember these things. Then next is disorder of articulation. What it is called as it is called as dysarthria, right? And disorder of voice production is called as dysphonia. So you should remember this things which are quite important. So aphasia, dysarthria, and dysphonia. Okay. Yeah. And these are the basic things which you should know, like what is phonation, what is speech, and what is language. And when you know these basics, then only you can examine a patient for an aphasia, okay, or dysphasia. Please don't uh, misunderstand this term, okay? Dysphasia and aphasia. These are the two types of speech disorders which can be classified further. So please remember this, okay? So what is phonation? Phonation is production of words with vocal sound with an added effect, like someone will have a nasal twang or laryngeal or vocal vibrations which are carried, and your tongue, lips, or your oral cavity, which is helping in phonating those particular sounds. So phonation is quite important. Speech is nothing but articulation, phonation of sound, leading to language production. And what do you mean by language? Please remember this: language is nothing but your higher function, which is used for proper communication through words, gestures, or written or spoken form, which is in a proper grammatical and selected words, and can be uh, used with specific rules. That is what language is. So you should remember this. These are the part of the definition. And language is nothing but what? It is a cerebral activity related to learning, thinking, expression, emotions, and to comprehend in a proper way. And as I said earlier, it is an important part of human behavior, and language is used throughout the day, right? To communicate, to express yourself. So for humans, it is important to examine your speech, because that will give you an idea that yes, speech is one of the important functions which must be assessed in CNS examination. Okay. Aphasia is further categorized according to the fluency. Please remember that whenever fluency is there, fluency we have to assess, and we can categorize aphasia into these two parts. One is fluent and other is non-fluent. Fluent is nothing but the same thing. It is the receptive or sensory aphasia. Receptive or sensory aphasia is nothing but Wernicke's aphasia. Okay, this is Wernicke's aphasia. And when it is non-fluent, then there is problem in expression, and it is called as motor aphasia. Okay, and this is nothing but your Broca's aphasia. So these are the two basic things which are usually asked in your exam. So please remember these two things: what is Wernicke's and what is Broca's. I'll give you its location and anatomical correlation. So those are the differential points which I'll discuss later in detail. But for now, just have this a simple idea how speech is produced, what is the importance of motor area and sensory area. For example, if suppose I'm speaking, okay, now I'm taking this audio lecture, I'm speaking, right, and you are seeing something on your screen, that is your visual input. What I'm speaking, what you are listening is auditory input. And tactile, if suppose someone draws on you or draws on your hand, you have that sensation, that is nothing but tactile input. So for speech production, you should have auditory, visual, as well as tactile sensations which are intact. This is a sensory input, okay, which gives input to your sensory area. Which is your sensory area? Sensory area is nothing but your Wernicke's area. Okay, that Wernicke's area will assess this information from various sensory inputs, and this Wernicke's area will correlate or gather information from associated areas, from associate areas. Like you have learned language, you're learning language since your childhood, right? What is communication? So that becomes a part of memory. If I'll ask you a question, what is your name? So you have understood the question. It will go in your permanent memory. Okay, then how to answer your question, that will be gained from your knowledge and social behavior and frontal lobe. So you will answer this question in quite scientific way. Okay, are you getting it? I have asked you a question, or you are reading a question. I have asked you a question, you are reading a question, or I have given you a note that what is your name. This input will go to your Wernicke's area. Then it will associate with your memory, then your frontal lobe, your short-term memory and long-term memory, along with the knowledge and all the grammar you know. Then this information will go through arcuate fibers to your Broca's area. And this Broca's area is what? A motor center. This motor center will then stimulate your vocal cords, your lungs, which will help you exhale properly while you speak. Then your lips, tongue, and your phonation process will start, right? So this information is given by Broca's area. So in basic understanding, your audio visual input is nothing but your sensations which you are taking in. It is processed by your sensory area. This sensory area associates with your other parts of the brain, where memory is stored, where your frontal lobe will make some decisions. Then it will go to Broca's. And after the Broca's, the motor center will get stimulated, okay, and it will stimulate other parts or organs of your body, and that will help in speech production. That is how speech basically is produced in every human. That, and this is the rough idea. I haven't gone into the scientific terms, but this is what you should know. What is the role of Wernicke's and what is the role of Broca's? So Wernicke's and Broca's. This is motor. Broca's area is motor, while Wernicke's is sensory. Okay, and this is the basic anatomy which must be known by you all to see. Sorry. So Broca's is Brodmann's area number 44, while Wernicke's is Brodmann's area 22. This is your motor cortex. Okay, this is the central sulcus which is there. Okay, so and this is the sensory area. Okay, this is the premotor area. So this is the motor area, then the front it is premotor area, while in front of premotor area is prefrontal lobe. Okay, and this 1, 2 and 3 are the gyri, and these are the sulci that you should remember. So this is superior, this is middle, and this is the inferior frontal lobe. Okay, and this inferior frontal lobe, your temporal lobe and frontal lobe meets. At the inferior side there is Broca's area. This is the anatomical location. Okay, and in parieto-temporal junction there is this sulcus. Okay, over here there is the location of Wernicke's area. Please remember this. And this is the parietal lobe, this is the temporal lobe, and this is the occipital lobe. This is the motor and this is the sensory area. At the base of the motor area is Broca's area. Okay, so we will basically go into the detail of Broca's and Wernicke's. Broca's, I'll repeat, is motor area. This is sensory area. Okay, remember this. This is nothing but speech production. This is speech which is sensed. This is sensory area. Okay, so this is the basic. So we will go in detail. See, Broca's is at the inferior frontal gyri. It is located over there. So if someone's Broca's is damaged, most common cause is stroke. Okay, that too ischemic. Okay, so vascular occlusion is very much important. So many a times they ask in MCQs also, what is the blood supply? So here is the middle cerebral artery. It gives superior branch and an inferior branch. Okay, so this is superior branch of middle cerebral artery, and this is inferior branch of middle cerebral artery. So please do remember this. This arterial supply is very much important. So if someone will ask you what is the cause of occlusion of superior branch of MCA, so tell them, yes, most common is thrombotic or embolic, which can give rise to occlusion of this artery. And whenever the superior branch is occluded, most likely the Broca's will get affected. Okay, so that is important. For Broca's area, which artery is important? MCA. So as we all know, it is also known as motor aphasia or expressive aphasia, because motor function is basically helping in assessing your expression. Okay, over here these are some technical terms. This must be known. One is comprehension. Comprehension is usually present. That means the patient can deliver a sensible meaning through his speech. That speech may not be perfect, it will be in parts, but he will be able to deliver his message. Second, grammar will be absent. Naming will be impaired. Repetition is also impaired. So these are some important terms which you should remember. So see, when Broca's is associated with your motor area, and it will help in identifying. For example, I'll show you a pencil and I will ask to name it. What is it? It is a what it is. So that patient may not be able to tell that it's a pencil, but he knows that is a pencil. If you will tell in one-way communication that whether this is pen, he will say no, and then you will say whether it is a pencil, he will say yes. That means naming is impaired, and if you will tell him to repeat what I have said, he will be unable to repeat that thing. So basically in Broca's or motor aphasia, there will be naming which is impaired and repetition which is impaired. Okay, he will be able to comprehend. If suppose there is partial loss of speech, that is what it is called as dysphasia, and if it is complete loss, it is aphasia. Okay, so please remember these terms. Okay, then neologisms. Neologisms is absent in Broca's, while telegraphic speech is present. Telegraphic is nothing but in broken words. Like in past, in World War One and World War Two, they used to have this communication, which used to have this telegraphic speech. Only important words used to get delivered, and that is important. In Broca's aphasia, usually you will have this kind of speech in most of the patients. Will the speech be fluent? No, fluency will be absent. Okay, so fluency is absent, repetition is impaired, naming is impaired, grammar is absent, comprehension is present. That you should remember. Telegraphic speech is present, and insight is present in this patient. Okay, insight, that means patient knows that something is wrong with him. Okay, he will know that yes, he is not able to name certain things. He cannot tell that this is pen or pencil. He will know something is wrong with him. Okay, so this is basically Broca's aphasia, or if Broca's area is involved, these are the features which everyone must remember. So this is over about motor area, which is the artery. It is middle cerebral artery. Artery is superior branch. Now we'll look about the Wernicke's area. Okay, where it is located? It is in supramarginal gyrus. This is supramarginal gyrus. Okay, are you getting it? Look, this is the part. This part is supramarginal gyrus. Okay, this part is supramarginal gyrus. Over there it is located. Which area? Wernicke's area. According to the Brodmann classification, it is area number 22. Okay, present at parieto-temporal junction. Which is the artery I have discussed? It is inferior branch of middle cerebral artery. See, comprehend will be impaired in Wernicke's also. Fluency will be present. This is the important point to remember. Fluency is present. It is also called as parrot speech. Parrot speech is nothing but patient will keep on talking like a parrot. If you'll ask anything, he will keep on speaking, but there will be no comprehension. There will be no meaning to what patient is speaking. Why? Because Wernicke's area is what? It is a sensory area. It is going to process your sensory information. If that sensory information is not processed properly, your Broca's is not going to get proper information. Then the information which is coming out will be non-comprehensive. You cannot comprehend what the patient is trying to tell. It is that simple. Okay, so neologisms will be present. Oh, so sorry. Neologisms will be present. Neologisms or jargon speeches, patient will make his own terms, new terms, and those terms will have no meaning at all. Like those words will never exist in the dictionary or anywhere in this world. So that is nothing but neologisms or jargons, aphasia. So naming will be impaired as sensory input is gone. Repetition will also be impaired. Though patient will be speaking fluently, repetition and naming is impaired in both Broca's as well as Wernicke's. Fluency is present. What? Fluency is present. Fluency is absent. Naming, then grammar, your repetition will be impaired in both. Okay, fluency is present over here. Over here, comprehension is present. Here, comprehension is absent. So these are the only 2 points which you should remember. But these are the 10 points which are there. Last is nothing but neologisms will be present here. It will be absent in Wernicke's, and insight will be absent. So these are the important points which you should remember. So guys, continuing with the differentiating features of various speech syndromes, you should know what is global aphasia. Second is Broca's aphasia. Third, Wernicke's aphasia, and fourth is conductive aphasia. So these are the 4 differential diagnoses which are usually expected from undergraduate students. So global is involvement of MCA territory. Okay, the middle cerebral artery is blocked. It leads to involvement of superior as well as inferior branch. So Wernicke's as well as Broca's is involved. This is called as global aphasia. Broca's we have already seen. Wernicke's we have already discussed. Conductive aphasia is nothing but involvement of the arcuate fasciculus fibers. Okay, and the site of lesion is posterior branch of middle cerebral artery, upper branch of Sylvian fissure, inferior parietal lobe can be also involved. Okay, so this conductive is very much important. Okay, the clinical features are nothing but paraphasia, difficulty in repetition and in reading loud. Okay, comprehension is normal because Wernicke's and Broca's are intact. Only the communication is hampered. Okay, so this is the important part which must be remembered. Others are not that important, but it can be asked in other practical exams. So quick revision of the same things. Okay, what is conductive aphasia? Conductive aphasia is nothing but the defect which leads to repeat phrases or words which are spoken by the examiner, that is impaired repetition. So in conductive aphasia, please mark this as an important point. And the site of lesion is nothing but your arcuate fascicularis. This is the important thing, and there is a connection between Wernicke's and Broca's. Okay, so the point which has to be remembered is the speech is fluent, because we know fluency is related with Wernicke's area, and it is intact, and it is meaningful. Comprehension is present, but repetition is very poor. So this is the most important tricky point, that repetition is very poor. If they give you in a question or clinical scenario that in patients repetition is very poor and there is involvement of inferior branch of middle cerebral artery, so it is conductive aphasia. It is that simple. Next is transcortical aphasia. So transcortical aphasia can be of two types, motor or sensory. If motor it is there, then it is anterior superior to Broca's area and posterior inferior to Wernicke's area. This is nothing but transcortical. Remember that the speech disturbances in these two conditions will be of Broca's and Wernicke's type, respectively, with normal repetition. The repetition is normal. While we have seen repetition is hampered in both Broca's as well as Wernicke's aphasia. Global, I need not discuss this because you know that both Broca's as well as Wernicke's is involved because MCA territory is involved. Okay, these are the few definitions. Please go through it. First is alexia. Alexia is nothing but impaired visual word recognition with intact auditory and writing ability of the patient. Okay, only visual word recognition is hampered in alexia, and there is intact auditory as well as visual ability of that patient. Agraphia is nothing but inability to write. Anomia, words are spoken in inappropriate with word approximation. This is very important. Word approximation. What do you mean by word approximation? See, the car can be called as carpet, pencil can be called as pental, apple can be called as pepal. So these things have to be remembered. Okay. So patient can point correctly. Patient can point correctly towards pencil if asked to the patient, but he cannot speak pencil as pencil. This is important. That is anomia. It is also called as clinically as one-way based naming defect. One-way based naming defect. Okay, that is anomia. So these are the basic things which has to be remembered by everyone. We'll discuss this later. Okay, so this is one of the important table. So see, Broca's, Wernicke's, conductive, transcortical, transsensory, anomia, and global. Okay, we have already discussed this. Now we are just going to revise this fast in a tabular form. Okay, so see, fluency is decreased. Comprehension is very good in Broca's. Repetition is not there, naming is not there. Okay, and lesion where it is frontoparietal operculum or the inferior frontal gyri. That is important. In Wernicke's it is opposite. The fluency is quite good. Okay, fluency is good. In Wernicke's the comprehension is decreased because there will be jargon speech, there will be neologisms, so comprehension will be hampered, while in Broca's it was good. So these are the two important points. This is good, this is good. Repetition and naming is hampered in both Broca's as well as Wernicke's. This is inferior parietal parasylvian region. This is frontoparietal operculum. Okay, in conduction, aphasia means involvement of arcuate fascicularis. Your fluency is good, your comprehension is good, but the repetition is poor. Okay, the repetition is poor. So this is the main important MCQ point, and it is also posterior perisylvian region. Transcortical motor. So see, it is motor. Transcortical motor. So what we have seen, that it is associated with Broca. So your comprehension will be good and repetition will be good. So these two things will be hand in hand in motor transcortical aphasia. While in sensory, it is related to Wernicke's. So similar findings will be there, but only repetition will be good. So whenever there is transcortical thing, please remember that to go with two things simultaneously. One is repetition and one is comprehension. Other is fluency and repetition. Okay, it is very simple. Try to understand this table in an important way. Just go through it the way I am telling you. Try to remember it in the same way. Okay, anomia we have seen. Anomia, in that fluency is good, comprehension is good, repetition is good, but naming is hampered. That is why it is called as anomia. Anomia, naming is hampered. Okay, and that depends on the type. No, not to go in that detail, but just try to understand it. In global, everything will be gone. Okay, because okay, thank you. This is it. I think I have cleared each and every aspect of this aphasia topic in an appropriate way. If you have any questions, you can directly contact me or message me on my given number, or you can email me. Thank you very much.